On liquid biopsy part 18, breast cancer circulating tumor cell, particularly about EMT CTCs. According to World Health Organization, worldwide cancer incidence has increased to 19.3 million new cases and 10 million deaths in 2020. In females, breast cancer is the most commonly occurring with high mortality, followed by lung, colorectal and prostate cancer. Predominantly, cancers are diagnosed at the later metastatic stage with a significant burden on patients and doctors. If detected early with precise biomarkers, the chance of cure is easy with the correct drug, dose, timing and therapeutics for leading a quality of life. Circulating tumor cells are rare and challenging to detect on early cancer patient blood samples. Interestingly, the clinical validity data of metastatic breast cancer CTC count outperformed the prognostic value of carcinoembryonic antigen serum markers from 17 centers for 1,944 patients from 20 study trials by cell search system like the recommended prostate cancer screening CTC count test than the conventional PSA prostate serum antigen test by NIIM by ISET CTC method. I will update you about the prostate cancer circulating tumor cell literature in the coming week's podcast episode. So please stay tuned for such scientific empowerment wisdom words from global experts and don't forget to subscribe to our channel. This week, let's focus on published EMT CTCs. The reason for choosing this cellular and molecular life sciences in 2022 review is as follows: to empower and improve breast cancer CTC detection and drug discovery platforms. Firstly, it is recent, good impact factor, peer-reviewed review. Secondly, written about epithelial mesenchymal transition and mesenchymal epithelial transition breast CTC literature update for new targeted therapies. Thirdly, comparative study of CTC methods with the established, commercialized and clinical utility of cell search system. In 2008, Sendurai and Weinberg's group cell study finding reported that transformed stem-like cells isolated from mouse or human mammary glands or mammary carcinomas expressed EMT markers, suggesting the link between EMT and epithelial stem cell properties. The recovery of patient CTC rate is affected by EMT, leading to a significant portion of undetected stem potential CTCs. Improved CTCs method and Australian SFRP for biomarkers research and therapeutics will expand the mesenchymal CTC drug discovery. Like our proof of concept STEM CTC technology, this review summarizes the clinical significance of mesenchymal breast cancer CTC published data, including in vitro spiked cells and patient cells. Research from 22 metastatic cancer patient pilot studies indicated the predictive power of eribulin response, determining both mesenchymal and epithelial CTCs at baseline. Nevertheless, still there are limited functional studies and characteristics of mesenchymal CTCs evidence. Mesenchymal CTCs occurred as both single cells and multicellular clusters, expressing known EMT regulators. In 2013, Shyamala Maheshwaran and Daniel Haber isolated mesenchymal CTCs as single cells and multicellular clusters in HER2 human metastatic breast cancer, suggesting the association of mesenchymal markers in clusters than single migratory cells. The detection and isolation of CTC count in clusters are clinically relevant. However, routine diagnostic and anti-cluster therapeutic treatment strategies require advancement with robust screening and automation for early breast cancer. Thank you. Stay tuned for next week's breast cancer epithelial circulating tumor cell and circulating cancer stem cells sphere review.